Hi, I'm Sebastian, and this is the Happiest CEO podcast, where we speak to world-class experts about biohacking, health, business, and what it really takes to feel and perform at your best. Our philosophy is simple: success by design, happiness by choice. If you're enjoying the show, make sure you hit subscribe so you never miss an episode. And to everyone who has already subscribed and supporting the show, thank you. It means a lot. Hi, everyone, and welcome to the Happiest CEO. I'm so excited to be here with Sebastian today. Sebastian is from a company called LongJev, but he has much more of a background than that. I'm really excited to dive into some medical topics, some more modern ways of looking at medicine. Himself has also gone through quite a process of figuring out how to deal with autoimmune disease. And I think that probably gave you some insight and also empathy for patients. Because Sebastian is actually a nice name, by the way, is actually a doctor himself. And he's now a specialist in rehabilitation medicine. He takes a holistic root cause approach and combines evidence-based care with practical lifestyle strategies to create lasting changes. His mission is simple: to shift healthcare from reactive to preventive. Welcome, Sebastian Pedersen.
Thank you so much.
So good to have you.
Wow, it's great
Yeah,
to be here.
yeah. You are a trained
Correct.
doctor?
I had to do 7 years of uni and then 4 years of resident training, 4 years of specialist training. And so I finished that journey 2 years ago.
Holy cow.
So I feel like I've spent most of my life just studying.
Yes.
So now it's time to live and actually make it useful.
Yeah, wonderful.
Yep.
And I think it seems that you quite early realized that the model that we have at the moment has its limitation, right?
Oh, absolutely. I mean, for me, medicine, I wasn't very academic in school. I was actually quite a bad student. I was typical teenager, purely focused on sports. Thought I was going to be a professional athlete, but then I got sick. And then from that experience, realized that, if we don't have our health, we really don't have much else. Like any dreams, any aspirations we have, they all fall by the side because our health is really the foundation of our entire life. Mm-hmm. And then that's what pushed me into pursuing medicine, not out of being a doctor, more out of I wanted to help myself from my own conditions. And then as I was going through medicine, I was like, well, I'm not unique. A lot of patients I was seeing were having similar experiences. They felt like, the sort of cookie cutter approach to, you have this problem, this person, everyone gets the same therapy, or everything gets the same treatment. Just wasn't where I wanted to go with it. Plus, there was not a lot of emphasis on behavior change, lifestyle modification. What can we actually do to prevent these life-changing situations in the first place? To try to enable people to have as much control over their health and life as possible.
Yeah. So even though Denmark is considered probably a very progressive country in many ways, when it comes to medicine, it's what we know the Western approach is.
I mean, I did all my medicine here in Australia.
Okay.
So I don't know exactly how the medical school and the medical training works in Denmark, but based on what I know from people there, it is very similar.
Yeah.
And it's probably harder to do what I'm doing here in Denmark with the whole preventative personalized medicine.
Yeah.
It's a little bit more different, whereas we have a little bit more freedom, I guess, in Australia within the public and private systems.
Okay.
Whereas Denmark, you don't quite have that capacity.
Yeah. And the status quo in many countries when it comes to reactive medicine is basically you have to show quite severe, I guess, test results or something for a medically trained person to be able to do something for you, right?
Correct.
Yeah.
So like for me, but also just how we view people in general. Like when I see a patient now or a client, I usually refer to people now as clients rather than patients, because not all of my clients are sick or unwell, or they just have a couple of minor issues we need to improve.
Yeah.
But also when I see someone, like when you see a doctor, the doctor would often say, right now your 5 or 10 year risk of X is 2%, so it's low. Whereas every time I see someone, I look at a lifetime view. Rather than looking at just trying to get you through the next 5 or 10 years, I'm looking at trying to get you through the next 30, 40, 50 years.
Yeah.
Which then encourages me to act earlier to try to change the trajectory, rather than just saying, you're fine now, kick the can down the road and then see what happens in 5 or 10 years time. And that's different. It's unique. And I appreciate not a lot of people do that, but it's just the way that I feel that I owe my clients the best possible outcomes in the future, rather than just thinking short term.
Yeah. And people like David Sinclair or Peter Thiel, they would talk about markers that indicates a problem in 10 or 20 years.
Right. Yeah.
And medical people might know, like, traditionally trained medical people might know that something might happen in 20 years, but that's not how our system is geared up. They wouldn't say, look, 1% right now, or like, this little marker already indicates you're on the path to that, because it's not a severe issue yet, right?
Correct. And that's exactly right. I mean, it's not that they don't have the knowledge, it's because the system is so saturated and is so full that you're just reacting the whole time. Like, you just imagine you have, 60 people you have to see in a day.
Yeah.
There is no way you can spend an hour with each person. There's just enough time in the day. So you just look at what is the biggest problem right now, short term, and then you sort that out, rather than, I'm lucky, I'm biased, because when I see a client, I have, 1 to 2 hours with them where I can really just sit down, work through everything. So it's a different model rather than just a traditional hospital system. So it's not the doctor's fault per se. It's just a system that's set up like that.
Yeah.
So because the knowledge is there. Like, wouldn't say that obviously I have a passion and a particular interest in what I do, but I don't see myself as super different to my colleagues or my friends who are doctors. It's just that I'm just doing things, approaching things a little bit differently in a different environment.
Yeah. Because is there also, I guess, when it comes to funding and health insurances and all the rest of it,
Exactly right.
A doctor has to play within that field.
Spot on. So I've got, good friends of mine who are GPs, and when I'm trying to when we have conversations about, well, how can we improve our patients' or clients' health outcomes, what they always come back to is, but how do I fit that into the Medicare system?
Yeah.
You know what I mean? So all of a sudden you're not purely thinking about what's best for the person. You're thinking about, well, how can I get paid for doing this stuff by fitting it to the Medicare system?
Yeah.
And then the thought after that is then, well, how can I improve outcomes? So it's just trying to fit to a model or system, whereas a lot of what I do is outside of Medicare because I'm a specialist. So just for understanding. So to see me, or for me to be able to bill Medicare in Australia, I need a referral from a GP or another doctor. Whereas people who see me come directly to me, which means that I can't actually bill Medicare for anything that I do, other than if I do request forms or imaging or scans or pathology. But the actual consult time, I can't bill Medicare at all for. So that's all private fee paying. So it's just a different way of the model works. And I'm just in a fortunate position where that's a model that works for us. But I realize that I'm also very privileged because a lot of people are just, they got taught one thing and then they become very, not tunnel vision, but they just get very adapted to providing in that or working in that model. And then to completely change your model of care from one day to the next, it's going to be very difficult for the doctors, because then all of a sudden, what are they going to do? They've got mortgages, kids, etc. So they can't just change their funding model from one day to the next.
Yeah.
I sort of made this decision consciously 2 years ago when I became a specialist, that when I started, this was what I wanted to do, rather than getting, I guess, set in that traditional pathway.
And it's interesting because where you're going into is something that could actually become a general model, being more preventative, right? Because I think part of why you only have 10 minutes or 15 minutes with a doctor is that the system is so busy, so many people coming, so that the capacity of the system is actually not there to spend a lot of time with each patient. So if you would have less patients because they actually know already how not to get sick or be more preventative, then I guess health insurances would feel less the pressure. Therefore, there would be more money to actually do.
Exactly. And if, like, statistically, so it's about 1/3 of all, I guess, causes of death or causes of disability in Australia can be prevented.
Wow.
Which still means that we still need the reactive model of care. We still need the safety net of Medicare to give you access to hospital or GP or whatever. But if we can prevent 1/3 of all cases, that's very significant.
Yeah.
And that's where I want LongJev to go. Like, I don't want to compete with Medicare. My goal is to provide a parallel pathway alongside Medicare. So if people want personalized or preventative or proactive healthcare, they then come to us for the personalized services. But if they want the foundational acute care, you're sick, you need a problem help right here, right now, then you still use the Medicare system.
Yeah.
Because a lot of people expect, like when I did my medical degree, I was never really taught, how Medicare was funded or how it started. So it started in the 80s with the goal of giving access to a basic level of healthcare for all Australians.
Mm-hmm.
Fast forward now, 40 years, and people expect Medicare to solve their problems. Well, like Medicare was never supposed to solve your problem. It was just supposed to give you some access to healthcare.
Yeah. Okay.
So I think having that mindset change of not relying on Medicare purely to solve your problems, I think is where we're going within the next couple of decades, because people need to take a bit more responsibility. They need to invest in their health, like they invest their finances, like they invest in education. So it becomes a different model, so that, yes, the government will still provide a basic level, but if you want a great life where you maximize your health span and your lifespan, then you're going to have to invest in your health in addition to just relying on Medicare.
Yeah. Love that term, which has been around for a while, but I think lifespan versus health span. Do you want to talk a little bit more about that? I love that concept.
Yeah. So lifespan being how long you live, and health span being the portion of your life that you're in good health, or has at least good function and good quality of life. The goal being that you want to get, personally for me and what we do for our clients, is we want to maximize people's health span. So we're not about biohacking, getting you to 120 years of age. We want you to live your life fulfilled to the fullest, and then the duration, or the last, say, 5 to 10 years of your life, and then you have a relatively rapid decline, rather than what happens now is you get to sort of 40s, 50s, 60s, and then the last 20 or 30 years is just a rapid decline where you're accumulating chronic disease, you're getting less independence, so you're needing care, nursing home, etc. So it's just a matter of, well, how can we push that down the road? So if you live for, say, 80 years, and 75 of those years are in good quality. That's the goal.
So what's your approach? What's the difference in approach that you take that the medical system can't really facilitate?
The biggest thing for me is really the lifestyle and behavior change. That's really, if you come down to the fundamentals.
Yeah.
Because anyone can request a scan. So how we approach each client at LongJev is start with the fundamentals, make sure people are exercising right, or moving right, sleeping right, eating right, managing their emotional well-being, stress, because those things are hard. Because once you really nail those fundamentals or those lifestyle behaviors, the rest becomes easier. We can always do a scan, do a blood test, but getting those fundamentals right takes a lot of time, a lot of effort at the start. And then once we've approached that, then obviously we add on all the comprehensive testing, from genetics to MRIs to pathology to gut microbiome to whatever it is. We sort of have that tiered approach. And then after we've done the lifestyle, then the medical care, then on top of that, like the 1%ers, then we add on, the supplements and all those sorts of things as well. So it's trying to start from, have a bit of a pyramid approach into what's going to give you the most return on investment. Yeah. And then just layering that throughout the journey.
Yeah. What are the top lifestyle changes that you find really make a difference?
For us, it's really depends on the person, to be honest, but most often it definitely comes down to sleep. I would say people are actually pretty good at it. Obviously, our client are early adopters, so they're a bit more aware, so they sleep well. But eating right and moving right, I think, are the two hardest things to really crack, I guess. And then also with our cohort, a lot of people are very successful, which means sometimes their emotional well-being takes a back seat because their whole life they've just been focused on business success or the next venture or this, but their actual quality of life, their purpose or their relationships or things like that has really been impacted. So we sort of have to pick that up a little bit as they go along as well.
Wow.
But what we do, and everything we do, is very data driven. So rather than saying, Sebastian, you need to exercise more, we'd put you through your paces to make sure, okay, well, everything that I'd want to tell you has to be data driven with a goal in mind. I'm not just telling you because I'm telling you. I want to say, okay, well, for example, with exercise, we do VO2 max testing, which is like cardiovascular fitness testing. We do strength testing, balance testing, power testing, and then based on the metrics we use, where do you score? How do you score? Where do we want you to be right now based on projecting you out in 30 years? And what I mean by that is we get the data now, but then based on our algorithms, we then predict based on age-related decline, we can predict where you're going to be roughly when you're about 80 or 90 years old.
Wow.
And then working retrospectively, where do we want you to be when you're that age? We figure out, well, how fit do we need you to be now? How strong do we need you to be now? And then we sort of create a program to actually get you there.
Wow.
Mm.
That's incredible.
Mm.
What do you find are the biggest challenges for people in terms of like specifics? Like, is it more the diet? Is it lifestyle, like alcohol? Is there one or the other?
Alcohol. I think it's time. It's probably the biggest one.
Time.
Time, I think, is the biggest one because everyone knows what to do. The hardest thing is actually doing it.
Right.
Yeah. So people, like, everyone has 24 hours in the day.
Yeah.
No one has any more. No one has any less. But to get people to actually do those small things, rather than being like, oh, I'm busy or I'm on holiday, I'm not going to do this. Just staying consistent over a long period of time is by far the hardest thing. Whether it's exercise, whether it's nutrition, whatever it is, it's just a consistency over time that's by far the hardest thing.
Gotcha. And what are your well, you don't use biohacks, but like what are your tricks to get people into it? Do you have to paint the doom gloom picture sometimes to actually give them a wake up call?
A little bit. I think that's definitely part of what we do.
Yeah.
It's not necessarily, but the goal is not to be provocative, but purely getting that data is very in your face. If you have a test now to be like, this is your fitness now, in 20 years' time, you're going to have troubles getting upstairs.
Yeah.
If you can't get upstairs, you're not likely going to be living alone.
Yeah.
You can't pack your own groceries. Like, you can't carry your groceries. Like, just simple things like that where it's like, okay. And then providing people a stepwise approach to where they actually need to get. Because just telling someone you're not fit is not good. We have to provide them with an actual strategy of how they're going to get to where we want them to get. And then breaking that down into smaller steps, being like, okay, the next step is to go to here over the next couple of months. And then we retest. And then we want to get you to here. And then we retest. So for me, I think the trick would be having that concierge approach, which is still hard because you still rely on some initiative by the people.
Right. But
being available throughout the week, us being able to contact them throughout the week, because we walk in parallel with our clients. We don't push them, we don't pull them. We walk with them to actually get them to where they want to go.
Yeah. Do you find that there's a particular age group that is more open to it, or like females are more, stick more to their routine than males or something like that?
Good question. I would say both. Our cohort right now is probably 2/3 male.
Yeah.
So, which is probably surprising. Often it's the reverse, because usually women or females are a bit more proactive regarding their health. But within that, I would say we have clients who are both female and both male who are doing extremely well. It's just a matter of who's, I guess, has the drive to implement changes now rather than waiting.
Yeah.
That's still my secret. I'm still trying to crack, or the ultimate, I guess the secret recipe is, well, how can we really get people to engage in these important behaviors on a daily basis for the rest of their life, which is sort of what is one of my, I guess, my passion topics on the side.
And what testing would you say are sort of the building blocks to really get that picture of someone's health and long-term health, that is,
exactly.
right? Yeah.
Exactly. I think I've probably over the last, say, 6 to 12 months changed how I approach that.
Oh, true.
Reason being is when we see our clients, I now have the approach to them that a lot of them come to me and they've never had anything done before. They've 60 years old, never had much to do with the health service or health Medicare or medical care at all. But they've just been so focused on their business success that everything has sort of fallen by the wayside. Which means for me, my approach for them, being the age group that they're in, is to rule out short-term risks before I can focus on long-term risks. What I mean by that is if someone's never had any medical care or any testing done, and they're, slightly overweight, they've got family history of heart disease, then for me, it's okay, well, I really want to look at things that are going to kill you or impact you today and tomorrow, which is things like cancer, heart disease, before I can look at things like dementia or metabolic disease, because those other things are going to kill you over a longer period of time and in the future. But things that's going to kill you here today, tomorrow is what I want to look at first. So what I mean by that is we often do both blood tests and imaging, trying to either prevent or detect cancer or heart disease early. So with with heart disease, it's different panels of cholesterol, glucose. We do calcium scoring, CT angiograms for the right people if they have very high risk. And then for cancers, you do genetic testing. You can do the cancer screening programs for the right people, especially with those with family history of significant cancers. You can do things like whole body MRIs, very topical, very controversial. But for me, and I can go a little bit deeper, is if someone comes to me, for example, with pancreatic cancer or history of pancreatic cancer in their family, there is no screening program for pancreatic cancer in Australia. So if someone's had a parent or a sibling die from pancreatic cancer at a young age, whether it be 40 or 50, then the health service would never detect that until it actually happens. Because in Australia, we only screen for bowel cancer. We're screening for now lung cancer, mammograms, so breast cancer for women, and cervical cancer for women. But if you have a history of brain cancer, pancreatic cancer, ovarian cancer, all the other cancers, they're just missed.
Even though they are tests?
Yeah, exactly. Because it's not part of the national screening program. Which for me, if someone has an increased risk of something, yes, there's no national screening program, but what is the right screening program for this individual?
Yeah.
Which is where we sort of offer that service. Because for me, knowing that family history or knowing that risk and then not doing anything about it, and then getting a cancer, and then people just say, oh, this is bad luck. Or it's like, well, it's not bad luck. We could have done something before. We could have actually had a look when they were much younger to see if there's something there.
Yeah. So just to explain the reason why we don't do this personalized approach, is basically there's a budget and we know, and I've seen this in public health. It was an eye-opener to hear, look, it's not the best what we put in our water, but from a public health point of view, it's much better than have cholera or whatever in our water. So, there's an acknowledgement that it's a trade-off, and it's probably the same with the type of funding of scanning, right?
It's exactly right. We look at the people crunch the numbers, saying in terms of where does it make sense to put money into this bucket to try to prevent things or pick things up early? But that's usually the most common causes, where things that are a bit rarer aren't usually screened for 100%. Like if they want to do these additional screening based on their risk profile, then they should be allowed to pay for them without the government. And that's where I think we're sort of in an interesting transition phase within the medical model or within the health system, where a lot of doctors frown upon that. What I mean by that is a lot of doctors think, no, if it's not part of the government, or unless it's something I'm requesting for you, it's not needed. Whereas for me, I'm trying to think of, well, how can I help this person be their best them rather than me applying my biases? And it's just a different, I used to have the same mental state or the same approach when I was, a trainee doctor in the system, because you just get adapted to the system. But now where my goal is just tied to how can I possibly achieve the best outcomes for the person sitting across from me. And that's where I come from.
Yeah, I see that often as a different way of health insurance as well. Like basically doing these testing so that you know where you're standing. Because really the cost, once you're really sick.
Oh yeah, it's massive.
And often health insurance does not cover that, and then it's a new mortgage on your house or something almost to actually get through that. So I guess the upfront investment is very much lower to when you're really sick and you have to pay for hospital stays or whatever.
Exactly right. Yeah, exactly. And that's where I think for me, you have if people are willing to pay, like for a whole body MRI, we'll use that as an example. Whole body MRIs now can be used to screen for certain solid organ cancers, from brain to abdominal things. But they're direct-to-consumer tests. So I don't actually have to be involved. A person could go and pay for a whole body MRI, about $3,000, directly from a company that sells it. Whereas for me, I'd rather be involved, because everything that I do, I need to make sure you do it with a reason, but also you make the data actionable. Because why I'd rather be involved with all of my clients who get whole body MRIs is, say something's identified in the whole body MRI, what happens then? The company is not responsible. So you're left with the report. You then have to try to connect the dots. And then you have to take it to a GP, and then your GP may be very interested, may be aware, and maybe like, yes, okay, let's do something about this. But there's that, I guess, hesitancy of, well, you're getting all this yourself. Now I'm responsible for it. They use your doctor. Whereas for me, I'm like, well, I want to be responsible for it, because if they find something, then I can help them with the next steps rather than just, I guess, handballing all the information onto them that they then have to make sense of it.
Yeah.
And I think that's probably my biggest value, where I find probably my biggest value for my clients is they can get testing anywhere. They can pay for blood tests online if they want to, but then making that data actionable into what is the next step for them is probably where I see my experience is probably the most useful, rather than just requesting scans for them, for example.
Yeah. And I found it genius what you guys have put together, because if you're really interested in health, you will read the books and say like, oh, I have to do this, I have to do that.
Yeah, exactly right.
The test for that.
Yeah, that's exactly right.
So I test every 2 years here and one test, and and after a while, it becomes just so onerous that, I would drop the ball, all the time, because it is. That's why we have specialists, right, for this type of thing. It's just a shift of, I guess what we saw over a longer period of time is just like really the system just trying to do the minimum. And people still thinking that's all that is needed for my health. Whereas to be, I don't know. I mean, would Medicare acknowledge, look, yes, more testing would be great. We just don't have the budget.
Yeah, exactly right.
Because if that's the case and people would hear that, then it's like, oh, okay, so there's a little bit on me as well to keep going there.
Yeah, I mean, I'd love a statement like that put out, that people like, this is what we fund. If you want things on top, or you have your high risk cohort, for example, then you have to pay yourself. But again, then with that statement, you're already selecting higher socioeconomic individuals, because people who are lower socioeconomic, they won't be able to pay for this testing. So it sort of becomes a little bit, the people who are well off can take care of their health. Which is a little bit of the problem, which is, I mean, my goal is sort of make this a lot more accessible. But as with everything, you start something, and then over time, the technology costs and everything gets cheaper, and then becomes a little bit more.
You would have seen that in the time that you have been in the field as well, right? The testing just comes down so much. Yeah, and I think for me, I think important for people to really hear that if you have a history of something and you know about that doesn't mean you have to do all the 50 tests or whatever. It's really like, so you were saying, what's something that, a heart disease, right? You have other people that died around you. That's should be instant trigger of like, what are the tests that I need to do to prevent that happening to me? And that doesn't have to be extremely expensive. It's just, it's logical to do, right?
Exactly right. I mean, heart disease is one of the easy ones, because you do get a lot of Medicare reimbursement back for the patient. And even things like, getting a blood pressure machine. Like, so many people aren't aware of what their blood pressure is, when it's probably the biggest risk factor of stroke and heart disease, or one of the biggest risk factors of heart disease.
Wow.
But no one checks it. You pay $50, $100 to get a blood pressure machine, and check it a couple of times a year or a couple of times a month, and then see where it is over time. That's such an easy hack you can do that people just don't do, because this is the education. There's this mismatch between what people should do and what people are doing.
I assume you're probably already starting to collect people's wearables data, or at least, look at them on a regular basis to be that concierge, and basically saying like, hey, you're a bit out of line there. Or, don't worry about that. It looks really good.
Yeah, that's one of my big side passions, is exactly the wearable sort of data. And we have it integrated now, which is good. So everyone's sleep, real time, 24/7, they exercise, what they're eating they take photos of their food, they get sent to us, we can see what they're eating. So we have a real-time snapshot as to what they're doing, which is pretty cool.
Yeah, great.
Yeah, I'm hoping all doctors will have access to that.
And we're going that way, right? And when you think about the 10 minutes or 15 minutes you have with your doctor, if there is already quite a bit of analysis happening through machine learning or something like that. Yeah.
Pretty easy for them. I mean, that's my whole vision of what we're building with the platform we're using as well, is that other people can use it to benefit them, benefit their patients, because what we're doing as well is, in this space, the only way the government's going to jump on and start to fund or support these programs is if we have data
Mm,
to show, a person signed up at time 0,
mm,
6 and 12 months later, this is what we can demonstrate.
mm.
But we have to have a lot of subjects or a lot of people with a similar outcome. And then once we have that data, you can then publish and then people can get on board.
I know some people that have always been into health, and they're the type of people that would go to their health food store or might be interested in also the odd workshop that is a little bit left of field and that type of thing, right? So, and I've seen people really thriving on that, but to me it seems a bit random, right? And like at times, but they're relaxed about it. So there's a big upside of how they approach life in general. They're not like, oh, I've got to do all of that. Oh, I dropped the ball on this supplement for 2 days and now I'm out.
Exactly exactly right.
And then you have the other side where people always check everything every morning, like what's my readiness to go, what should I do? I have some people that have a marker that if it's under, I think it was 90 with the Oura Ring, I won't come to work. They have a day off. It's like, okay, well, maybe there's something in it, maybe that and I think there's a healthy medium. What do you like? What's your approach? Like going a little bit further on that, I understand. Like if you have risk in certain areas, really look after that, right? But what's your approach so that people don't get too hung up on the numbers?
Yes, and that's probably where the reason I actually started my couple of years ago now, why I wanted to build this platform was there's so much data in a wearable, especially like the Whoop or the Aura. Garmin's probably a little bit more simpler, but there's a lot of it that's just, for me, completely irrelevant.
Really?
Yeah. Like
even as a doctor?
Yeah. It's like if you present that to me, I would, there's a couple of markers that are very important for me, but a lot of the data that these wearables spit out, I just don't pay attention to at all. So I think if we can simplify that to being like, okay, well, which are clinically relevant for you and for the doctors to know, and then sort of try to remove all the noise, because they're just there's a lot of data, a lot of noise, especially in the app of one of these wearables. And a lot of it's, fun, but it doesn't move the needle in terms of your health.
Oh, really?
Yeah. So that would be, why I've wanted to really break down and to sort of, extract what's important and then make the consumers aware of what is actually important, rather than just taking, Aura's word for it or Whoop's word for it. Because at the end of the day, they're still selling a product. They want you engaged. They want you to keep doing what you're doing. And yes, their vision is to improve people's health, but they're not directly accountable for, diseases or health span. It's just trying to get people aware and more educated, I guess, is their perspective.
How much can you rely on the data that comes from commercial wearables like that versus medical devices?
But they're not as good as medical devices, but pretty good. Depends on the wearable. I know sleep, for example, is the best with Aura. Aura I think it's 80 or 90% sensitivity and specificity, and then Whoop and then Garmin. But then if it's like exercise or heart rate during exercise, Garmin's at the top and then Whoop and then Aura. So it depends on the marker that you're interested in.
Yeah.
But in terms of what you're wanting to use it for, like for me, I use Garmin purely because I use it for my exercise, my interval training, etc. So that's best for me. If you're sort of a weekend warrior, maybe a Whoop will be better for you. If you're just a general wellness overall, Aura is probably better for you. But then the most important thing is monitor trends over time. Don't get too focused or nailed down with the individual result, the daily readiness. Look at it. Well, what has it been over the last 3 days, 5 days, 7 days, and then over sort of weekly/monthly trends. You're going to get much more reliable data from that.
Right. And would you recommend to really sort of check your data like every day and really sort of engage with it?
I think so.
Okay.
For me, it's a matter of being aware of things. Like it's like doing a continuous glucose monitor, whereas where you put a monitor on you, then you scan the actual, you download an app, and then you can check your blood glucose levels real time. Like it's very educational. Like if you're feeling off on a day and then you look at it and you're like, my HRV is really low, my readiness is low, my strain or stress is high. And then you can be like, well, what have I done the last couple of days? And then retrospectively, you can be like, oh yeah, I missed that sleep there. I had that alcohol that night. And then you can sort of put the pieces together to be, and then they become better informed for the future. So I think it's very important in that sense. In terms of relying on it to get you to achieve a certain outcome, though, is probably And what I mean by that is if you're relying on it to, for example, prevent heart disease or cancer or things like that, it's probably not the right case for that. But for general awareness of how your day-to-day behaviors impact your overall health,
Yeah.
pretty good.
That's cool. You mentioned alcohol there, and, I guess it's still commonly used to be. I grew up with sort of post-war parents. It was so dominant that I got turned off for sure. And I do know that there's a trend like around the world. We are in the wellness space, so we know that people sometimes choose actually wellness experience over going to the pub and that type of thing. That's great, and you probably see the same. How bad is alcohol in general, and then for individuals? Because I know for myself, I don't know why, but it has never worked for me, and therefore I'm scarcely using it.
Yeah. I mean, alcohol is probably the most accepted drug or harmful drug, to the human. Like you have that and tobacco, really.
Right.
I mean, alcohol has become such a normalized behavior in society that people try. I mean, this is obviously, maybe I should have prefaced with this, but I don't drink alcohol at all, and never have.
Right.
So I'm obviously very objective, because I don't have any subjective experiences where alcohol's been, useful. But if you look at it, if someone was to bring alcohol into the market now, if we just forget everyone's been consuming alcohol for centuries, then it's probably a drug that's not going to get approved. You know what I mean? We know it causes throat cancer, liver cancer. It can significantly impact your immune system, sleep. I mean, it's not a very beneficial substance. If you think about it. Just pure. I know there's some people say, but there's what about the Mediterranean diet and the blue zones and all that sort of stuff? Whereas for me, looking at that data in terms of like the blue zones, the Mediterranean diet and all that, they're getting good outcomes as a population despite alcohol, not because of alcohol. They're just because they're doing everything else right. They're moving, they're eating well,
they're socializing.
Exactly right. They're still getting the benefits. But imagine how well you could live if you then also remove, the toxic substances. That's sort of the next level, the next tier. So for me, I don't see the need for alcohol. I think it's been far too normalized. And, I mean, in Australia, consuming, what is accepted? Is it 2 drinks for males per day and 1 for females per day, which is still a lot over a longer period of time. I mean, I personally, objectively looking at the data, don't see why that's the case. And, same with tobacco. If someone was to bring tobacco onto the market now with the data, it wouldn't get approved. But it's just because legacy things have been approved and it's part of culture and it's accepted.
Is New Zealand still going ahead with basically phasing it out so that...
I believe so. I can't remember the year though. So you have to be born before a certain date. Which is pretty cool.
And I guess eventually no one is alive that is allowed.
Yeah.
It's crazy.
It is crazy. I mean, I just, I don't see the need for it, obviously. And people, I appreciate that if people want to just focus on health span, being a little bit more relaxed on that perspective, if you want to have 1 or 2 drinks a week, fine. But sort of, the 4 drinks Friday, Saturday, or Thursday, Friday, Saturday night, or whatever it is probably too much.
What about coffee and caffeine? I remember doing, I'm a private pilot, so but you still need to go through medical tests that are quite stringent. And I remember, I think I just had a workout powder that I use, and the doctor is like, "Look, I can't pass you. Your heart rate is just up there." And have a look of like what the milligram of caffeine is actually that you're taking every day, because it will wear out your heart. And that was a real wake-up call for me, and wasn't even aware of that. So I mean, it's probably not coffee as such, but it's caffeine, right?
I mean, I'll split that into what are you using it for? Like when I know people ask me about supplements, the goal is, well, what are you using it for in the first place? So caffeine, if you're using it for performance, like sports performance, very beneficial. If you're using it for general daily life, health and well-being, it can be useful, but just make sure it doesn't impact your sleep. And yes, some people can metabolize caffeine better than others, but wear a wearable. I mean, because that's probably the most accessible. I mean, it's not realistic to expect everyone to get proper sleep studies over a week without caffeine. then have caffeine, and then see if it impacts anything. So it's always, trying to do a bit of diagnostics or a bit of testing to see if it actually impacts you. So if it doesn't impact you at all, great.
Mm-hmm.
It impacts me personally. I don't have caffeine, just purely because I want to sleep well. If you do have caffeine, yes, one drink early in the day, but half-life of caffeine is still 6 hours, I believe. So if you have a cup of coffee or say 100 milligrams of caffeine in the morning, and then 6 hours after that, it's going to be 50. And then 6 hours after that, it's going to be 25. So there's still going to be caffeine in your body in the evening when you're trying to sleep, which can thus impact your overall sleep quality.
So the main issue is really the sleep that is affected by caffeine. It's not so much like that your liver can't.
Yeah, correct. Yeah, correct. That's mainly from a sleep perspective is just the caffeine. Yeah.
Okay. Are there any other obvious sort of things that are accepted? And what I've found in Australia is people take a lot of painkillers.
Oh yeah, massive. Yeah.
And I think now it's
yeah.
Which maybe there's no problem there. I don't know, but it certainly feels, well, if nothing else, it takes the awareness of an issue away.
Yeah.
Because to me, like if I have a headache, there's a reason for this headache. Sometimes it's structural, I worked out wrong, but sometimes I didn't have enough sleep. Sometimes it's, whatever. And I found that actually fairly dangerous because you can't monitor actually your body anymore. But like, is there any other sort of downside that we overlook?
I mean, from the painkillers perspective?
Yeah, like,
I mean, the painkillers, depending on how much you use it, it's, you can buy Woolworths or whatever you go.
Yeah.
And then from a paracetamol perspective, you want to make sure you're monitoring your liver. If it's like Nurofen or anti-inflammatories, making sure you keep an eye on your kidneys, your gut, ulcers, also bleeding risks. So there are risks associated with these things.
Yeah.
Again, it's assumed that people are going to use it as prescribed. But I think of those two, I'd probably say anti-inflammatories. I would probably see. I mean, if I was to prescribe anti-inflammatories to someone, it would be for a specific period of time, lifelong.
Yeah.
Unless you have some sort of like inflammatory condition where a rheumatologist is looking after you and you're getting good care. But to use Nurofen more than say 3 to 5 days regularly is probably too much. You just want to make sure you're doing these short courses. If it doesn't settle, you need to get checked out. Don't just keep using it because it hides the pain.
Yeah. Which is really like, that's the opposite of being conscious of things. It's like, yeah. What are your favorite tests that you do with people that actually seem to be quite fit?
Quite fit. I would say, I mean, good question. Like if we focus on, I've already looked at excluded thing people haven't got, significant coronary artery disease. They can have a heart attack or any major cancers, and we know that from genetic testing they don't have any major risks there.
Yeah.
If I was to have a couple of markers, I really like omega-3. I really like, for some reason, I just find that a super good blood test. So you do a blood test. The reason why I like it is it's so well defined as to test you. And you want to be in the range of ideally sort of 10 to 13. And then you can improve overall inflammatory will reduce inflammation, help your brain health, but also helpful for your heart. The simple things like that people I think are missing, where it's very easy to make that result actionable. What are people often consuming far too little omega-3 or far too little fish? And then once we tell them that, they could either consume more fish, and the people that don't want to consume more fish either because they don't like it or taste, for example, then we supplement. But then there's a flip side of then they have too much fish, and then we have to test a lot of mercury. So it's sort of simple things like that. It's about being taking a very good history to get an idea of, well, what is their day-to-day life like, and what do we need to really look for in them.
Yeah. It's an alternative marine phytoplankton or anything like that?
I use either an omega-3 oil or a capsule. You can definitely use them. It's just a matter of making sure you get the right ones. The ones I use are fish derived though.
Yeah, but probably tested on mercury and that type of thing. Yeah,
that's the reason I use them. Just third party tested and things like that. Yeah.
Okay, so what does it tell you if you test someone on that?
It just gives you a number, which is really good. So the numbers that I look for is one is like omega-3 index.
Yeah.
Now it'll give you just a number, say 5 or 4 or whatever it is. And most people are always below 8. Ideally, you want to be above 8, ideally 10 to 13. And then once you have that number, you can be, okay, well, based on your fish intake, then we just need to do this. And then repeat in 3 months. And most of the time, problem solved. So it's a very easy one to sort of tick off and then move on to focus on other things.
And that's heart health in particular?
Yeah, heart is very important for heart health.
Yeah.
In terms of if you're reducing the risk of heart disease.
Mm-hmm.
I think what is it is if you're below, if you're at a low number, like I can't remember if it's 1 or 2, and then you increase it to around 8, you've got like a 20% reduction in like a major heart attack or things like that. So it's very dark. Like if you just by simply eating more fish or having a supplement to reduce your risk of something by 20%, it's pretty big.
Yeah.
And some people, I think the lowest I've seen is probably 1 or 2.
Yeah.
Which is just someone who's never eaten any fish. And then for that person who falls in that bracket, just by supplementing it, we've already reduced their heart disease risk. And especially for this person who already had some calcium in their coronary artery. So just adding things like that on top, just to try to be a bit more targeted in terms of any intervention we provide.
Yeah, and that's a typical example of where you probably with a GP you wouldn't get to that point.
No, I mean, not a difficulty, but the omega-3 test is out of pocket.
Yeah,
which means that often out of pocket tests aren't discussed. Because as a doctor, when I was 10 years ago, when I was busy in the hospital, for some reason, I actually don't know where that came from, but for some reason, we assume people don't want to pay. Because we're so used to people getting things for free through Medicare, right? Like in terms of like the basic level of stuff, and hospital care especially. But I don't know why some reason we don't ask. Whereas I think that conversation, we need to start having those conversations, based on what I've seen so far, based on your data, I reckon when we do these 3 tests, the one's going to cost $50, one's going to cost, like the omega-3s cost $90, but it's very useful for you. We don't have those conversations enough in healthcare yet. And I think we need to. That's probably our fault as a medical profession. It's definitely not the consumer's fault because they don't even know of these tests to start off with.
Right.
So I think that's another area of room for improvement.
Very cool. So let's talk a little bit about LongJev, because that is very sort of cutting edge of how I guess, if you read the right books and the prevention is really and longevity and health span is important to you, you basically put this all in a program to be able to facilitate that for a person that wants that, right?
Pretty much. Yeah. Pretty much. I mean, because I wanted to do this. So it's, right person, right time, right, like that sort of stuff is just, I'm very fortunate because, 10 years ago, I always wanted to do this, but it wasn't a thing.
No.
Right. So I was always like, well, how am I going to make this a job? Because this is what I want to do when I finish. And then people like Peter Attia, who for me has ultimately validated what I wanted to do 10 years ago. Right. So people like that are showing me that, yes, maybe it's doing it differently, but that there is a need for this. There is a demand for this that I wanted for myself when I was a patient. Because the way I look at it, I'll always be a patient for longer than I'll be a doctor. So that's sort of what drives me a little bit. If I was a patient, like right now, if I would remove my doctor hat, what would I want for myself?
Yeah.
So now fast forwarding to when I finished my specialist training in 2023, I've been creating this program over the last pretty much 4 years. So I was very lucky. I worked very hard. So I did my 4-year training program, specialist training program, in 2 years.
Holy cow.
So I had 2 years to plan this.
Yes.
Right. So the last 2 years of my training program, because I did all my exams early, I was really just planning this for when I finished. I then started up a private practice in start of 2024, doing still a bit of sports med, still a bit of rehab, but really focused on the longevity preventative health space. And then I met Kevin and Zara, who are now the co-founders of LongJev, through a friend of a friend. And then we happen to have very similar views about how we want to do this. It's not a biohacking clinic. We're not selling products. We purely want people to have a personalized health service that moves the needle, plus actually helps them and is responsible for the results. And then we built that and started that sort of mid to end 2024. We're still at the stage now where it's very concierge, high end. Everything is customized to each client. Like if you see me, for example, I wouldn't give you an off-the-shelf program. We have off-the-shelf programs on our website, and our website's a bit outdated now, but I spend the initial 30 minutes with a patient just taking a history, and then I get access or consent from them and get access to look at all their previous records from pathology companies to everything else. And then based on everything historically, based on where they are now and based on where they want to go, I then created a customized recommendation that lasts 12 months. The reason why it's a 12-month program is, again, the accountability piece. We're not a consultation service. We don't want people to just pay for advice to give you a recommendation or advice. We actually want to get you there. And that's why having that 12-month program increases the likelihood, because then over 12 months, we have access to you. If you have barriers, questions, concerns, you have access to us, any day of the week. So that's where we're starting. And obviously, as we refine the model more and more, then we'll make it a bit more democratized, or get more clinicians involved, but it's still very personalized.
Yeah. So you said that 10 years ago you had the vision and the need, I guess, with your cognitive fatigue as well. Do you find that consciousness has really evolved to the point that people understand the whole topic and the ins and out much better?
I would say outside of medicine, yes. Personally, and this is just could be a reflection of me, but if I talk to my friends who are doctors, I guess other specialists, surgeons or whatever, about doing what I'm doing, the majority I'd be like, don't really understand it, don't really understand why people would pay for it. And I guess it's not a reflection on them. It's just a reflection on, they've been very focused on one specialty or one area of practice for a long period of time. Whereas I sort of always, because I'm not tied to medicine, as I said earlier, and I think that's probably important. My identity is probably still more athlete than doctor.
Right.
And because that, I'm not necessarily, I don't view myself as, this specific doctor, I have to do this.
Yeah.
I'm just, well, what is the major gap right now that we're facing as a society? That's chronic disease. Most of these are preventable. So what can we do? So I'm really just solving a problem that we're facing with that, rather than just, I guess, enabling the system to just keep doing what it's doing. Right now we have a problem that's not manageable by the system. Well, how can we solve that problem?
Yeah.
So it's being a little bit of a problem solver, I guess.
Yeah. And I think surely people wake up to that fact, because they're on the other end. The health system can't provide as much anymore, which means at one stage it's, look, either this person can die or you have to pay privately. And I think that's where really the whole prevention piece.
Oh, it's definitely growing. And I think as more of, myself, and we have other clinics doing what we're doing or similar space in Australia, I do believe this will become mainstream.
Yeah.
You're going to be going to a doctor, they'll have access to your wearables, they'll be telling you to do, lifestyle medicine is now its own society as well. So there's things like this that are popping up that's going to be very useful, and that, future generations are going to benefit from. But again, I'm very impatient. So I want things to happen now. So if we can get things going, tomorrow, that would be great.
Yeah. What role do you think AI can play in this field?
Massive. Yeah. I mean, even just if I focus purely on me, and what I'm doing in terms of LongJev, what I'm visioning now with the tech platform that we're using in LongJev wouldn't be possible without AI. It'd be too manual, too laborious, too expensive. So it's going to be massive. Where I see there's two different directions of thought is, you have some companies who are wanting to replace doctors with AI, and you have some companies like us who wanted to pretty much enable doctors with AI. So like my vision for myself in a couple of years is that I will no longer be, doing day-to-day work, doing traditional consults, coming up with traditional recommendations. I'm just going to be high-level thinking, coming up with strategies, meeting with, having conversations with my clients. The AI will take care of, the data collection, the data execution, the treatment plan execution, and everything in between. That's where I see I want to. Obviously, I'm a doctor, so I'm probably a bit more biased.
Yeah.
But it's also if I had like a purely objective business play, I just don't see governments from a liability perspective wanting to trust AI within the next decade or two.
Yeah.
If they do it, I mean, they may decide to do that, but just I think the liability thing, who's going to be responsible? Is it going to be the AI model? Is it going to be the company? Is it going to be this, like the actual company that makes the AI? Is where they're going to point the blame? Whereas right now it's too easy, just it's the doctor's fault. And I think that I guess that status quo, I think, is going to be persisting for a little while longer.
Yeah. Do you think AI can be used to, you were talking about sort of like the conforming actually with your health recommendation or habit recommendation?
Yep.
It seems to be big, like people actually sticking for a long time to it, right? Yeah.
Exactly right.
How would AI be able to help us there? Have you seen sort of user cases? Because I'm personally also interested in that. Yeah.
In which bit, in terms of?
Oh, I mean, like really like, I guess what I envision is like that it points out you haven't eaten enough omega, or you have eaten too much, that type of thing, or your exercise has lapsed.
Correct.
Or your sleep is, like actually really sort of like a co-pilot of saying
exactly
like,
right. And that's what we're building now.
Right.
So we're building exactly that. But the difference where we are is it's still tied to the doctor's plan. So what I mean by that, if, like, for example, if you were to see me, I would come up with a plan, and then the AI would then real time be assessing everything you're doing and being like, hey, Sebastian, you're really dropping on exercise or sleep, but it ties back to the doctor's plan, which means the difference there is the AI is just executing what the doctor wants you to do, or rather than making autonomous decisions. So I think that's a difference, because as soon as the AI starts saying, you need to do something without any guardrails, I guess, I think that's where right now, I don't think the models are quite there. They'll probably be there in the future, but I still think that within health, there's still going to be very specific guardrails for the AI models.
Yeah, fair enough. Yeah. And I guess people are become also over time open and also know how to use it responsibly.
Exactly right.
That's right. Yeah.
Yep.
That's cool. So in the future, there might be a way of actually having a mostly AI based.
I think so.
Yeah.
So whether it's VR or whatever it is, but I think there's definitely going to be, like, objectively what I envision is I'll have some sort of, whether it's augmented reality, whatever it is, and then I'll be able to see each client's data, whether it's just you put on some glasses and here it is, or it's like a holograms that comes up. Have you seen the movie Iron Man?
Of course.
Yeah, right. Jarvis, right?
Yes.
That's exactly what I envision. Based on where we're going now, I'll be able to bring up a hologram, this is your health, that's what I'm doing, this is what you need to do. And then it then takes care of it, and then Mason connects with you, being like, Sebastian's just reviewed the results, this is what we're doing, create a new treatment plan, off we go. And then it will real time coaching you to actually do what you need to do.
Oh.
That's what I envision in the next 5 to 10 years.
Yeah.
So I'm not sitting there, you have to drive to me, or you have to go on a Zoom to see me, or a Teams meeting to see me. Then we talk, then we come up with a plan, then I send you the plan. Like, that's so outdated based on where we're going now. And I do believe that medicine and healthcare is really going to benefit from the AI changes coming.
Yeah. I followed. Well, I follow tech trends. I follow Peter Diamandis, for example, who would talk a lot about, look, it's just a token problem, right? So if the server farm can just focus on one particular piece of medicine and the research, we'll actually find solutions. I found that, like, would you share that view?
I would say, to a degree, yes. But I'm also, I guess, had the experience now to being like, it's not like a tech problem. Like, a tech problem is, same solution for everyone.
Right.
You want to pay through Stripe? You go through the same journey.
Yeah.
Right? But people are so different to another that if I want to improve your cholesterol, exactly what you're doing, the next person might not be able to do because of intolerances or access, so there's going to be a lot of variabilities or customizations individually between cohorts.
Yeah.
Yes, big picture is going to be relatively the same, but it's really, but I think is an advantage for us that the fact is we're doing this from the ground up, rather than we got an AI, we're OpenAI or Anthropic, and we just want to throw money at this problem.
Yeah.
Us actually doing the medicine and the care on the ground is going to enable us to create better algorithms, and be able to tailor it a bit more personalized. Obviously, again, I'm not sitting in a big executive in one of these big companies, but I do think that it has to be from a ground up approach, rather than, like, they're all, like, Microsoft, OpenAI, Anthropic, Perplexity, they're all creating like their own co-pilots, health platforms now. But I still see that there's going to be then harder to. There's one thing of having people having their health passport, but there's another thing doing something with it.
Yeah.
And I think that's sort of the gap where I feel like clinicians like myself probably have a massive advantage.
Yeah.
Yeah.
In terms of finding solutions to certain illnesses, where do you see that going? I just recall, like, I think last week or the week before, basically one insight was that AI is not too lazy to look where other people would say no point,
very point. Yeah,
right?
very good point.
And I found that interesting because that's a human element almost. Yeah,
exactly. Right. I would find that massive. I know they're spending billions of dollars in R&D and health and building proteins now with AI, but a bit of from a personal experience, I have ulcerative colitis. I know my specialist and when we have chats, we still think there's some microbiome origin to that, to why that happened. Being able using AI to just look at all these gut microbiome organisms, looking at different compounds in the gut, and then just really going through all that data, figuring out if there's a difference between me to people that don't have ulcerative colitis. I mean, something like that would never have been possible. I mean, it would be, but it would have taken way too long, which means I wouldn't be benefiting from it.
Yeah.
So I definitely agree with that. Just being able to, put AI at something with all the resources and see what happens.
Yeah. So, like, I have a little bit of a vision for our wellness company, which is really, what was it called? It's not the Stevensons. There was a comic sort of cartoon in the 70s and 80s, and it was basically people living in space, and they would just go into a room, get dressed, get washed, and all the rest of it. And I believe health could be a little bit like that. Like certainly have, like, my vision is really that within an hour you can get most of what you need in terms of those needs, and that. It's physical, but also, emotional and so on. I think you can do a lot there. But if we talk a little bit about sort of what that could look like and where AI or technology can help, would you expect that, at one stage we accepting that we get up and AI actually says, hey, you didn't have the best sleep, don't have a coffee, or, just plan your day a little bit differently to take it a little, cut a notch. Yeah,
definitely. And I think the whole problem with now is health is not front of mind. What the AI benefit is going to be doing, it's going to give you real input when it's needed. Like, and that's ultimately what behavior change comes down to, right? It's not you knowing what you need to do, it's you acting at the right time. So what I mean, but if you wake up, right when you wake up, the AI is going to be like, this is what you slept, this is your sleep score, you didn't sleep well, which means right now, don't have the coffee. Whereas, the night before, if it tells you don't have coffee in the morning, you've slept, you wake up, you've forgotten, and you may still have the coffee. Well, it's just really about timing it to the individual to then jump over those hurdles so you don't have the coffee, or you do the exercise, or whatever it is. That real time nudging, I guess, is super important.
Yeah, wow. So potentially, this is great news for humanity. It is actually.
I think so. I think it's massive. I think it's a massive benefit.
Yeah. I guess we've never been. I think some people have been always good and intuitive. Like, for example, I've been quite fortunate that I had a full-on operation when I was 16, and that really, part of my intestine was taken out. So I was really sensitive to what I ate. The flip side of that is that I was really sensitive and realized, like, oh, when I eat pizza 3 times a day, I actually, it hurts, or, I don't feel great. And I guess, but that's not the normal, not normal average person in the street will not have that sensitivity. And I guess that's where AI helps and says, you might not know about this, but I can see in your data,
exactly right.
you really want today just eat salad or whatever.
Exactly right. Where the issue will be, which will change, is getting the data. The data is always going to be the problem, because for the AI to be able to work off that test, like the wearable lifestyle is easy because it's already there or accessible. Or the medical data is where we and say that Kevin, Zara, and our LongJev team are very passionate about. You own your healthcare data. What I mean by that, if you go to a blood test with your GP, do you get that data?
You have to request it.
And then even then, you have to go through barriers, you have to call someone, you have to wait. It's super hard to get your own data. It's like,
surprising.
Well, you took my blood test. Can't just give me my data, right? So I think creating and I know people are building like their digital twin and all that now as well. but you have access to all of your data. I think it's going to be super important, so you can decide where you want to go with it and what you want to do with it, rather than relying on the clinician or the clinic to own your health data. Because then as soon as you have your health data, as the models get better with the right supervision, whether it's, people like me or other people, just making sure there's no hallucinations, because it's very good at convincing you otherwise. So just making sure that someone's sense checking all this,
yes,
I think it's going to be very important. But getting the data is going to be the flick we have to, or the switch we have to flick to make sure every time, whether it's you, whether it's me, friends, family, or anyone else gets any testing done, start collecting your own data.
Yeah.
So that when this stuff really hits the floor and everything goes forward, you have your data, rather than you're trying to backpedal and trying to collect it from 10 different clinics over your life.
Yeah. I think it's super important to point that out. I think I'm fortunate I have a very good friend. One of my best friends is a doctor in Germany. Normally when kids are sick, it's normally at night, so I can call him, I can ask him. And but every now and then, I go on AI as well and check, and it is often wrong. And where he puts just a real life sort of like situation to it, all sorts of things. Yeah.
And I think, when people say you have a PhD level expert in terms of AI in your pocket, I think that's spot on, because there is a big difference from being a research specialist, from being able to apply things in real life clinically. And I think that distinction is always worth noting.
Yeah. Because the average, let's talk about children. I mean, like the average child might be always a little bit obese. Might be, not like vibrant health. I mean, nowadays that's a thing, isn't it? Whereas I'm not saying my kids are perfect, but like I know that they're probably healthier than the average. He would know that and would say, the risk of doing this or that is much lower with your children, therefore you go down that path. Whereas AI would not necessarily know whether they're average.
Exactly right.
Or the other side is like really obese children, and again AI would just go the middle path basically, and he would so I can see where you're coming from. So this is really the personalization, and
exactly
a human probably for quite some time will be in the middle of it.
Exactly right.
What are normally goals that people come to you with? Is it just I want to live long, happy life?
I'm very lucky that people usually, some of the best goals are still, the one couple came to me and they had three very clear goals, and I just love it. It's like, first one, don't die from something stupid.
Okay.
That's goal number one. And then be able to get to their 70th wedding anniversary. It was like a major, like a round number anniversary, which they then projected it, meaning they have to live until like 2050 something, or 60. I can't remember the actual number, but it was just very clear. So those goals I love, because then I can start to sort of map things out. Obviously, there's always a bit of ambiguity and nuance there, but usually in terms of traditional standard goals, it's improving body composition.
Being fitter.
Improving, their appearance, their strength, their fitness. Some people have seen the same health service for 5 to 10 years, and their cholesterol's still up, or some biomarkers still very concerningly high, and they come in. I just want someone just to tell me, why is this high, and what can we do about it? So just things like that. And some people just come in being concerned. They've had a friend or a family member who had a significant life-changing event, or someone passed away. So they just want to look at, is that something that could happen to them? So it's very, very variable. Which is good.
I
like that.
Talking about people wanting to live to a particular age, I know the average, as far as I know, is actually not improving much, but actually I think in the US at parts going also backwards, meaning like people live shorter, right? If we use this technology, your insights, new testing and so on, right, could we live longer, healthier?
Good question. I think we can definitely live healthier. Because the last 10 to 15 years of our lives now, statistically in Australia, are spent with declining quality of life. So the health span problem is an easy problem, not an easy, hard to solve, but easy to look at. Yes, it can be solved just by preventing disease through the middle age, making sure people actually take care of their physical health so that when they get older, they're not falling and fracking their hips, or they're not getting, heart disease and things like that. The lifespan question is much, much harder because already we're living longer than what we were biologically meant to. Like our DNA wasn't, and this is I've taken this from one of my friends, but we weren't meant to live past whether it was 40, 50 or 60, a couple of centuries ago. So right now, the fact that we're living to, 80 or mid 80s for women, and was it 79 or 80 for men average in Australia, that's already well past what we should be living for. As to how far we can push that, I'm not sure.
Yeah.
But it would be surprising to me that if we really go down this path and really personalize everything and then navigate major life events that people wouldn't have been able to dodge before, that they would be able to live longer. That would then by default push out the life expectancy and number. Whether it's, 120, 140, probably not. Whether it's, pushing the average life expectancy from low 80s to 90, possibly.
Yeah.
So I'm definitely going to be observing very interested with a lot of interest going forward.
Talking about death, what's your view on life? Like, do you see meaning in it all?
Yeah, good question. So so when I was 15 and I got ulcerative colitis, I was told, your rate of bowel cancer is going to be this, or this is what your life is going to be. And it was sort of mapped out for me, and it wasn't a very nice picture. And then when I was 18, I got another secondary condition related to my liver. And then they said that, within 5 years, or definitely within 10 years, you'll need a liver transplant.
Wow.
Or you're going to get liver cancer or cholangiocarcinoma, so cancer of the bile duct. So already from the age of 15, every year when I either got my liver scan or my colonoscopy, I was like, this is a year. This is a year. I'm going to get it. And then so that sort of helped really make it very obvious for me that nothing is guaranteed. We have to live our life every single day, which is, now that I have a family, I have a fiance or a partner and 2 kids, I think I'm working harder than ever, because in terms of purpose, yes, I have, Freya, my platform, LongJev, my health service. But my biggest concern, obviously I'm well beyond what they told me back then, but my biggest concern is something happens to me and then my family aren't taken care of. So my biggest driver is actually making sure that everything is taken care of. So if I'm not here, my kids and my partner for the rest of their life are taken care of.
All right.
So I definitely do. That's my probably one of my biggest driving, probably the biggest purpose in life. In terms of outside of what I think, I think having meaning in life is super important.
From a health perspective,
absolutely.
Huh? Yeah, wow.
I ask that question to every single person who comes to see me.
Really?
Super important, because at the end of the day, I can look after your heart health or your exercise or whatever it is.
Yeah.
If you're not finding meaning in this snapshot of time you're on Earth, what's the point of doing all this? And then if you don't have meaning, we need to provide an environment for you that you do find meaning in and that you actually enjoy living life, because it's such a short experience, really.
Yeah. Where there's no vision, people will perish.
Yeah. So emotional health and what drives people and purpose is important. As to, do I find there's a meaning in life in general?
Yes.
It's a good question. I'm not sure. I believe, in Danish you say, translating across, there's something more than earth and I guess the sky.
Yeah.
Pretty much saying that there's or heaven and earth. There's more than just heaven and earth. I mean, I don't believe in like a god or a deity or anything like that, but I believe everything happens for a reason to an extent, whether that's just our way of our brains trying to make sense of everything. Not sure. But I definitely do believe there's so much more that we have no idea as to, even from a medical point of view. Like there's just so much data that we're missing in terms of life, energy, all that sort of stuff.
Yeah. There seem so many stories probably that you've seen as well, where people fight the odds or like behave. Yeah, that's amazing.
Yeah.
Every guest that is on our show actually gets asked for questions. So one is a very simple one. If you could have a coffee or green juice, whatever you like, with a person dead or alive, who would it be?
If I had to choose one,
you can say it.
It would be my family. Yeah, that's everything I've been through and everything that's happened to me. Without them, I wouldn't be here. So that would be the people I'd spend time with.
Yeah. This is why you become a doctor, eh?
Yeah, my mum started. So when I got sick, my mum sort of didn't take no for an answer. She was just wanting to pursue all possible pathways, really. Yes. So she sort of put the idea in my head when I was young, that what can possibly be do rather than just labeling a condition with a treatment. What else can be done? And at the end of the day, like my colitis has never been in remission. Like it's always been active, but, and this is a big but, my quality of life based on how I live my life, second to none. Like when I get my scopes, I had my scopes last month for my colonoscopy. It was still active, but it really doesn't impact my day-to-day life. I can do whatever I want to do. That's because I'm very disciplined in my day-to-day life. Versus before I decided to be as disciplined, I was tired, I was fatigued, and life was just hard to get out of bed in the morning, to be honest.
Holy cow!
So that would be the people who I'd spend time with.
Yeah, fair enough. What was the most impactful book that you've read? Favorite book?
I think I'd never say I've been like mind blown by a book, but I think if I had one book that I'd want a lot of my people I love and clients to read, it would be Comfort Crisis by Michael Easter.
Okay.
Not a traditional sort of, high profile book, but in terms of the problems that we're now encountering in day-to-day life, most of them are because we're just too comfortable. Whether it's because we're too comfortable in terms of our physical health, we like sitting on the couch watching TV, whether it's our emotional health, we're not getting challenged enough or we're not experiencing certain things. So I think Comfort Crisis is super important.
It's an interesting concept. Actually, I often think about younger generations having a problem of doing hard work or, being challenged, but that might be actually not fair on them. It's just that over time it has come down and with, has lowered, and the younger generation displays it more. But I think we all are more comfortable and don't want to do that. Yeah. I miss that sometimes. I guess seeing that, this can be done or we'll be fine. And interesting. Thanks for that.
Yeah.
I'll check it out. Hey, how do you start your day?
So my morning is very similar, 7 days a week. I get up, I have my couple of 2 glasses of water, a cup of tea, and I read Danish. So
just for yourself.
So before family and kids are up, then I do my exercise, come home, have my breakfast, and which is usually the same 7 days a week, which is usually homemade bread, avocado, sardines, cucumber, tomato. That's it. And then there goes the day.
Yeah. What type of exercise do you do? Do you mix it up? Or?
Yes, I do. Well, at the moment I'm doing running. So I run 4 times a week. I swim twice a week and I gym 3 times a week.
Nice.
Which is a little bit less than what I used to, but it still gives me enough.
Yeah.
In terms of, I still need a lot of exercise to keep me going.
Yeah.
Just because I love it. It's having, trained for 3 hours a day for so long. I need at least an hour and a half a day just to keep me going.
Yeah, fair enough. What's the best advice you ever got?
I would say I had a really good childhood with my parents, especially the first 9 years of my life in Denmark before we moved here. Then things started to change.
Would you say that Danish people in general got that right? Like that?
I think so.
I mean, I did a lot. I took a lot of holidays in Denmark as a child. There's the solidness of that childhood. Yeah,
I think that's why I'm pretty. I was having a chat with Vanessa about this last week. Like, I'm very fortunate. So I don't, a lot of people my age that have anger problems or self-esteem problems, or like reflecting on my brother and I, is I was very confident. We don't seem to have any major problems that other people are encountering from an emotional perspective. But I think growing up, the best advice that I ever got from both my parents and now also my step parents was, it didn't say don't settle, but if I had a dream, my parents would either decide to push me further than I would want to, or if I had just a crazy dream, they'd just be like all in, supporting that. Like they would never set a ceiling for me. So for example, when I was a kid, and I still remember it, my first big dream was I wanted to be the first person on Mars. Yeah, I know. Technically, I can still do that. Yeah. It's not something I'm thinking of, but that was my first dream. And then, my parents supported that. It was just like, well, how are you going to do that? Trying to map it out for me in terms of, then you have to be an astronaut, you have to be good at the science topics. Like it's just mapping that out. Yeah. And then, because I always set quite aspirational dreams for myself. So the best advice would just be really just go all in. Like just think about the best possible situation. Don't settle. Yeah. And then just go for it. Yeah. Wow. I think that's sort of helping me pretty well so far. Yeah.
Oh, that's really cool. Hey, before I let you go, I just wanted to talk a little bit more about LongJev, because I'm really excited about you guys doing that ahead of the curve and having such a service available. First of all, is this Australia only, or can we do this?
Yeah, we just do Australia at the moment.
Yeah. So it will become probably available in time overseas as well?
Possibly. Yeah. We're still at the moment sort of we haven't really gone west of Adelaide. So we're still sort of going Townsville down to Melbourne and east. So mainly on the east coast. Yeah. Now slowly building to the west side, or to the west coast. But as we really refine the model and the program, it's the barrier between we want to move quickly whilst also having quality of what we're doing, making sure everything is customized. So you're not getting off the shelf programs, because a lot of, there's companies in Australia who are get the same program regardless of what your risks are, right? And that's not really the vibe we're going with, or the problem we're trying to solve. So it will be a little bit slower probably, for good reason, than other companies trying to just hyperscale. But the goal is definitely Australia first, and then we'll see where that takes us.
Yeah, great. And if people want to get in touch with you, that would be LongJev.
Yeah, I mean, the easiest way is to email me personally. So my name, same as your name, Sebastian at LongJev, LONGEV.com.au. Yeah. And then every person who's interested, I usually meet with them for free for 30 minutes, see what they want, see if we can support them based on how we approach things. Because some people just, want biohacking and peptides and whatever, and that's not really our vibe just yet. And there's no evidence in that field. But then we have a 30-minute consult and see where that takes us.
Very cool. Very cool. And normally you subscribe for a year?
Yeah, we do that. We don't offer any single consults unless it's for a particular reason. Yeah. Like someone's having a major life event and they just want someone to sense check something, fine. But usually whatever we recommend for our client, we almost always do a 12-month program, just so we can, retest on the concerns of interest throughout the year to make sure things are actually getting better. Yeah. And then it allows us to change the plan rather than having one plan for 12 months. 12 months is a long time. We want to iterate as we get more data, as the person either does well or doesn't do well. We just keep modifying to help them.
Yeah.
Mm.
Really exciting.
Mm.
Well, thank you very much for making time.
My pleasure.
I'm really excited about what you guys are doing. I believe it's the future anyway, and you moving this forward and it being available for people now is so good. It takes so much personal research off the plate, and really, if we're honest, you need a specialist really to really customize it to your individual needs and wants. So thank you so much for doing it, and thank you so much for being here.
My pleasure.
All the best.
Thank you.